So Dr. Lewis he's a scientist, he's an educator, he's a physician, and he is very much a health officer in terms of bringing all of those parts of his career and himself to the leadership role and to stepping into that role around whatever the public health issue is of the day.
In medicine, I've had 3 different careers. I started as a research scientist, first working on herpes virus, then on HIV. Then I was a pretty much full-time doctor up at OHSU. I started the pediatric HIV clinic and ran the hospital, Children's Hospital Infectious Disease program. And then in '04, I had an opportunity to move to public service and join the state public health division so that I could learn about public health. That was mostly about outbreaks and foodborne illness. But when I came to the county is really when I think I finally found my home, because this is where I learned about equity and social justice and social determinants of health. And I've really loved every minute of my career here, trying to work as far upstream as possible to help people before they get sick, rather than waiting for them to be near death.
Is that like you being called for work right now?
Well, like I say, I've got a couple of jobs, and this is my week.
This is gonna make the video.
This is my hospital week.
There has not been a public health crisis in this community since about 2011 that Paul Lewis has not put on his bike helmet, climbed onto his bike, turned on his lights, and led us through the dark forest. The E. coli outbreak at Chipotle, suspected cases of Ebola. Paul got the fire departments, the ambulance, and hospitals ready for a suspected case. And then when we actually got one, personally drove groceries to the family involved so they could stay home and stay safe. The heavy metals around Portland's glass manufacturers, lead in Portland public schools, and he led the testing of more than 500 kids in a single week to assure parents that their kids were safe, because we didn't know. The Cully Auto Salvage Yard fire. And with no money, staff, or mandate, Paul led the effort to count people who died while experiencing homelessness in the annual Domicile Unknown report. Opioids.
We're living in a crisis where people I know are dying weekly, and I am confident that without Paul's leadership, things would be so much worse. I'm not saying that things aren't bad right now, right? But, you know, Paul championing the Good Samaritan law has made it so people do call 911 in the event of an overdose. Our access to naloxone, giving naloxone out, coming out of jails. Like, these are things that really we know are life-saving interventions for folks. And I don't believe that many of those things would have happened without Paul.
Taking him down to Salem was gold for Multnomah County because he was so trustworthy. His word was his bond. I didn't have to check to make sure that he was correct. He was always reading, always staying up on issues, always talking to folks, always looking at what could we do to improve, public health.
Paul is an educator, and he, in our old Gladys McCoy building, there were often whiteboards in rooms, but often the markers were missing. And so I brought a prop because he would actually carry a dry erase marker with him.
You always got to have a dry erase marker. In fact, I think we could look, see if I've true to my word. I have not only a Sharpie, but also a dry erase marker. So if there's a whiteboard, I'm on it.
Paul once commented to me that being at an executive level at the health department, it's not just a job. He said it's like giving your life to the county. And I would say he has done that. And he has done that in spades as the health officer and as someone, again, with this skill set and this range of abilities. I feel like he has really served us all well.